Thank you so much for having me. Pleased to be here not only as a healthcare professional, but I believe I'm the only woman on tonight's panel, so pretty pumped about that. So John did a beautiful job in the beginning of explaining why we are all here, but I just want to take a brief moment to recap. We're here because people are getting sick, and they're getting sick from vaping. And you know it's a big deal because we have an acronym for it, and it's EVALI. And that stands for e-cigarette and vaping associated lung injury. It's been present in all states, Puerto Rico, District of Columbia, and the U.S. Virgin Islands. Only Alaska has been accepted from cases of EVALI, and 42 people have died. And what happens when people die is the media tells everyone that e-cigarettes and THC-containing vapes are going to kill you. And that's a problem for a couple of reasons. Mainly because we don't actually know what's making people sick. Vitamin E acetate seems to be a main culprit, but we aren't entirely sure of the actual final answer. And the other issue with that is that the large majority of these cases are from illicit and unregulated products, and that's not being properly reported, and it's scaring patients. And a perfect case example of this is in New York State, there have been 0 cases of EVALI reported with legal products that have been purchased within the regulated medical cannabis program. Now, why is that? Because New York is really good at regulating. It's one thing we do really well. So the first point to make is that we have a pharmacist in every single dispensary. And that's important because we have patients who have complex disease states who should not be vaping. And we have the experience not to give them a vape product that may cause illness. And that's very important. That clinical oversight is a big differentiating factor when it comes to patient safety. The second is that in New York, every single batch of cannabis medicine is independently tested by New York State labs. And I don't mean once to make sure the formulation is fine. I mean every single lot that is made has to be tested. It's tested for contaminants, adulterants, pesticides, molds, fungus, heavy metal, and potency. So we know exactly what is in the products that we're selling to our patients. And that's incredibly important. And vitamin E acetate is not on that list of approved products. And they test for it, and none of our products have it. So that protects our patients' safety. So what you'll see at the bottom of the list in New York that is really interesting is that we don't allow smokable forms of cannabis. You cannot buy whole flower in New York. And so that begs the question, well, what can you buy? So all of the products in New York are oil extracted based products. We have capsules, tablets, tinctures, oral solutions, and of course, vape products. And so that often begs the question of, look, people are getting sick. I don't want to vape. I can't get flower legally. So why don't we just get rid of vaping altogether? Why don't we just sell oral solutions, tinctures, capsules, stick with oral dosage forms, and call it a day, and that way we won't have any of these issues? Well, the problem is that not all cannabis formulations are equal. So when we talk about absorption, oral cannabis only has about a 20% absorption rate. Sublingual is around 30 to 40%. Inhalation is around 60%. So you get the best absorption of cannabis medicine through inhalation. It's also the fastest acting formulation. And so patients that are medicating, there are a lot of different disease states that need immediate relief. If you're having a PTSD panic attack, you can't wait 20 minutes for a sublingual formulation to kick in. If you get overwhelming nausea from chemotherapy, you don't have time to wait before your head is in the toilet. And so inhalation works almost immediately, and that's really important when it comes to patients getting the medication that they need and it working effectively. And the final thing that we know is that when we inhale cannabis, we get the best effect of the entourage effect. The flavonoids, the terpenoids that are contained in cannabis are best utilized by the body through absorption. So now we're in a situation where people are getting sick, people are afraid of vaping. We know inhalation is a really important dosage form, and whole flower is not available in New York. The last thing that we want is for patients to be going to illicit market flower that's very likely to be contaminated or adulterated or contain things that people shouldn't be putting in their body. And all of the panelists are here to talk today about what we're doing to combat this issue. And so I'm super pumped because what Curaleaf has done is brought flower to New York. So today marks the first day in all 4 dispensaries. We have flower available. You can buy it legally. It's been tested. It's clean. It doesn't have any contaminants or adulterants, and you can vaporize it safely. And we think that's really important. So shout out for that. Now, this is one thing, right? So all dispensaries have a responsibility. As dispensaries, we need to continue to do research and product development like the flower pods to bring products to patients that are gonna be safe and protect them from illicit products like the vapes that are causing illness. That's step 1. But there are more things that as dispensaries and registered organizations, we're responsible for. We're responsible for making sure our staff is clinically educated. Even if you're in a state that doesn't have a pharmacist present, your staff should be trained on when you should and should not recommend vape products to patients. That's really important. We also have a responsibility to be the source of truth for our patients. We need to be able to explain to them when they come in terrified of vapes, the truth, that it's illicit, that our products are safer than illicit, that we test them. So that regulatory process from the dispensary angle is really important. We need to be testing our products and to the highest rigorous standards that we can and making that information available to our patients so they can trust in what they're purchasing and making sure that we're educating them on not to use illicit market substances and why. That's really important. And that is all the last thing is access, sorry. That's the final piece is access because not everyone lives near a dispensary, not everyone has access to safe, regulated product, and so we need to make sure that we offer things like delivery from the regulated market to make sure patients have access to medicine that's been tested and regulated. And that's all. Thank you so much.